With Miranda Kahn, J.D. Hayworth back with you on America's Forum. Miranda, we were talking earlier about the public policy implications, or really the public health implications, this latest wave of illegal immigrants. On the phone right now, Dr. Larry Bush, an infectious disease specialist. Dr. Bush, we thank you for calling into America's Forum this morning.
Oh, thank you. Happy to be here.
Dr. Bush, what exactly does it mean when the Center for Disease Control activates its Emergency Operations Center?
Well, in essence, what the center's looking for is any new introduction of possible epidemic-type diseases that they have to be aware of and try to prevent and forestall. And that may be a concern with increasing immigration into the country.
Well, and we've been talking about, earlier we were talking about some of these kids that reportedly have measles, scabies, chickenpox, strep throat, lice, and now we have 3 confirmed cases of the swine flu. How concerned should we be about this?
Well, for me, the major concerns would be the vaccine-preventable diseases, those childhood vaccines that we mandatorily give to all children here in this country may not be the same thing that's going on outside of the country. And that's usually what leads to any new epidemics of measles or mumps or even things like influenza in this country, because in essence most people for the childhood diseases are immunized where others may not be. So that could be a concern.
Right, and we've been hearing reports that the medical staff treating some of these children on the border have been told not to disclose that they are seeing anything like we just mentioned, the measles, the swine flu, or anything, otherwise they'll be arrested. Have you ever heard of a situation like this where medical professionals have been threatened or silenced in this kind of way?
No, and in fact that goes against all infection control guidelines or recommendations, or even what we call syndromic surveillance, where you survey for new epidemics or entry of diseases so that you can see if they're spreading. So that would be quite the opposite of that.
And the other problem, Dr. Bush, in addition to the heavy hand of government acting in martialistic fashion, what's going on with a lot of these people being flown out of detention centers, put on buses, put on airplanes? There's a situation where these highly contagious diseases can spread to the general populace. If you had to put a probability on that type of thing, is there a way we can quantify it?
You can't really quantify it until you would start to see outbreaks or cases. But if somebody does enter the country who has active diseases such as measles or mumps or polio or even tuberculosis, which is an interesting thing, or influenza, then putting people on planes and buses and spreading them could be devastating, because those are diseases we generally don't see here.
Dr. Bush, tell us, for families with the holiday upon us, for your family, what do you do to protect your family with these kind of reports coming out?
Well, fortunately, for again the childhood preventable diseases, most Americans are immune because of childhood vaccines or booster vaccines later on. Big threats could be things like influenza, because a large part of our population does not choose to get vaccinated. So you'd have to look for signs and symptoms of the flu, even in the time when people wouldn't expect it, such as now, the summertime. But also, tuberculosis is always a concern, because it's a very prevalent disease worldwide. It's just not that prevalent in the United States. But the latest statistics in our country are that almost half of the cases are from people who come from outside the country. Less and less are people who live in this country permanently. So that could be things. So you'd be looking for signs of mostly respiratory diseases.
And what are we looking at, like in terms of treatment cost, would you say?
Well, obviously, if there's an outbreak of any type, whether it's tuberculosis or influenza or any of these childhood diseases, the treatment costs escalate in both the quarantine, the investigation, herd vaccination of people who may have been exposed, and any antivirals or antibiotics that may be necessary. So it could get very costly, just as it has in other outbreaks that we see.
Right, like the swine flu. Can you give us an idea? Because we have 3 confirmed cases of the swine flu.
Well, when the swine flu entered a few years back, probably from Central America and from Mexico, at least into this country, it led to probably millions and billions of dollars of cost.
That's big. Hey, we'll have to leave it there. Dr. Bush, we thank you. There's more to come on America's Forum.